Thanks, Christina, and good afternoon, everyone. I'm Rebecca Sliz, Senior Product Marketing Manager at Imbrivata, and happy to be here with Chris McKay, our Director of Nursing, and a couple other members of our Imbrivata Patient Secure team, including Steve Goldstein, our Sales Specialist, and Tom Miner, our Senior Product Manager. And we are grateful to several of our customers who have agreed to join us today. And I am going to ask themselves to introduce themselves in just a moment. So again, we're talking about Patient Secure, and when being positive is a good thing, the need for biometric patient identification. That's our session for the next 45 minutes to an hour or so. And I encourage you, as you've been doing throughout this session, to put your questions in the chat. We will either answer them as they fit into the conversation, or we'll save time for questions at the end too. So with that, I would like to ask Jose from Harris Health to kick off our introductions.
Hi, my name is Jose Cerda. I work here at Harris Health Systems for over 12 years. We've been utilizing Patient Secure here at Harris Health System for about 10 years going now.
Great, and now the team from Atlantic Health.
Hi, I'm Danielle Tylock. I'm the Executive Director for Patient Access. I have responsibility for all of the registration areas that use the technology at the point of entry.
And hi, good afternoon. I am Chrissy Prano. I am an Epic Revenue Cycle Manager that supports Cadence and Prelude and Epic, as well as Palm Secure and other applications.
Danielle and Chrissy, and now Tara. Hopefully Tara's on. There you are. Just unmute yourself, Tara.
Nope,
Not
still
quite
muted.
yet. There you go.
There you go.
Good afternoon. All right. Good afternoon. My name is Tara Neisel, and I am an IT operations manager here at Sentara Healthcare with responsibilities for our Patient Secure implementation. I've been with Sentara for about 12 years, and we have had Patient Secure since 2012. We have deployed at 9 hospitals and are deploying to a 10th next month, and the final 2 at the end of March next year. So, and we also have Patient Secure deployed to many of our clinics across the enterprise.
Great, thank you, and welcome to all of you. Thanks for joining. So there are a number of reasons why organizations might purchase or use Patient Secure as a positive patient identification solution, from patient safety and patient experience to duplicate record resolution and revenue cycle efficiency. So I'd love for each of you to share a little bit more about why your organization implemented Patient Secure, and also what kind of benefits or results you've experienced with the solution. And for this question, I'll ask the team from Atlantic Health to lead us off.
I apologize. I'm literally choking to death right now. Danielle, would you mind?
Sure.
My allergies are so bad.
It's okay.
I'm so sorry.
It's okay.
You have a couple of an ER doc and a nurse on it. When you say literally choking to death, I like want to go and resuscitate, but we can't do anything over Zoom, so resolve it.
Yes. So Rebecca, so I actually wasn't here at Atlantic when we implemented. So why don't we start with the next facility, and then we'll just circle back. Does that make sense?
Sure, that sounds fine. So Tara from Sentara, we'll go over to you.
Sure. So I think initially we were looking for a technology that would allow our organization to reduce duplicates and overlays. But as we have been using the technology longer, we've found that the safety benefits are really immeasurable. You know, we have several patient safety examples where you know, a patient presented while having a stroke and was able to be identified due to the technology. You know, and even folks in our community are recognizing Patient Secure as a technology that is a patient safety measure. We've had a judge that had a patient who was convicted of identity theft to mandated that he be enrolled in the system. So, you know, I think that alongside of our initial ask, we've found that really that the patient safety is where we're finding quite a bit of benefit.
Mm-hmm. Mm-hmm. Chris, I knew you were going to jump in. Go ahead, please.
So I love the fact that we oftentimes separate the two, that the overlays and the duplicates are not a safety issue. Because from a clinician standpoint, I know that there's money and revenue tied to the back end of it. Absolutely. I mean, it's great that we save money. Yay. I mean, it's good. But from a clinician standpoint, if I don't have the right record when we get him to the emergency department and I have no idea that he has one kidney and I rush him down to CAT scan and burn off one of his kidneys because of the dye that we put through, we're like, oh, this is traumatic. This is something that could be detrimental. This isn't just no longer just a revenue overlay issue. This is a real safety issue. I don't like to separate the two. I think they have they're not exclusive to each other. And I think to that point, you have some other great stories about some of them there that really does even help change some of the workflow too. And we can get into some of those as we go on. Thanks.
Definitely. How about Jose from Harris Health? Tell us a little bit more about why Harris initially implemented Patient Secure.
Yeah, just, keeping on that theme in regards to the safety of the patients. So here we implemented the Patient Secure 10 years ago. We have we're a safety net hospital. We have a very diverse population of patients that come here. One of the highest primary group that comes are, the Hispanic population, would tend to have a lot of the similar names. One being like Maria Garcia, which we identified. We almost had 2,700 Maria Garcia set in the system. So we have two different process flows where we utilize the Patient Secure system. We're the clinic side where the patient presents and palm scans as soon as they show up. And ultimately they provide us their date of birth and then we find them in the system quickly. So we now have gotten accustomed to finding the records versus having to do a search within Epic. So we've almost spoiled either the staff and the population that we service because it's such a quick throughput of getting them identified. Through the emergency side, we also use it as a safety mechanism, but the process flow is a little different where the nurses are the ones that use the Patient Secure system. And so when a patient shows up unconscious or conscious, they can ultimately palm scan them, identify their record, and make sure they got the right record before assigning them and getting them throughput through the emergency. So that's, I would say, one of the high reasons that we started using Patient Secure here at Harris Health Systems.
Mm-hmm. Super. And Chrissy, are you recovered a little bit? Can you share a little about Atlantic Health? All right.
I'm sorry about that. So historically, we had Imprivata that was linked in with our STAR McKesson system. As for patient safety and avoiding those medical duplicates as well as patient safety, we brought about 1,000 providers on Cadence and Prelude in the Epic module in 2017 and found that the majority of the duplicates were coming from those physician practices, less from the actual hospital side. So then we have definitely seen, we have one of the lowest duplicate rates in the country. It's definitely under 1%, way under 1%. Moving forward, one of our patient safety compliance has requested, due to patients with having very similar names, is implementing the point of palm scanning at the time of checkout in order to make sure that patients are getting the proper ABS forms when leaving, because there seems to be sometimes they're getting mixed in with printing. So that's something else that we're moving forward to as well.
Great. And you rolled into some of the results that you're seeing in terms of the low duplicate rate at Atlantic Health. I wonder if Either Tara or Jose, if you wanted to add a little bit about any benefits or results that your organizations have seen from using it. And I see Jose nodding, so I'm going to take that as a sign that I can call on you next.
Absolutely. We work very closely with the medical records department. We were sending out reports on a biweekly basis with the administration and our team, and letting us know how we were doing in duplicating medical record numbers. And once we implemented the Patient Secure, those numbers significantly decreased. We take the guesswork out. Ultimately, they gave us a date of birth, they put their palm on the machine, and ultimately the system provided us what their record was versus having to do a search. Like I said earlier, we have over 2,700 Maria Garcias, so there's a real easy possible chance that we're going to make a mistake. I think we even have over 300 of Maria Garcias that have the same date of birth. So it's very easy to get a mistake with 17 different satellite community clinics and 3 pavilions within our Harris Health system.
Tara, would you like to add on to that in terms of what kind of results you have experienced at Sentara?
Right. So, you know, here at Sentara, we do have a team that manages our duplicates and overlays, and we, you know, they are really constantly, I want to say, advocating the utilization of Patient Secure, because with the use of technology, you know, we are able to make a correlation with that rate. Like Christy, you know, our rate here at Sentara is already pretty low, not quite 1%. So we'll have to talk more about how you guys are doing that. You know, using the technology alongside of best practices, I think really has just allowed us to implement additional hospitals, additional facilities, and still stay around about the same rate. So.
Great. So we have an Epic group here today in many ways, Epic panelists and Epic audience and Epic users. And so the next question has to do with sort of integration of Patient Secure and Epic and other applications or systems that Patient Secure might be integrated with in your systems. So for example, welcome kiosks is something that Patient Secure integrates with. I don't know who among you is using them today or might plan to use them in the future, but question is around, you know, integration, system integrations, and how smoothly those work for you or not. So for that one, I'll ask Tara to lead us off. Tara, you don't look like you're on mute, but I can't hear you. So maybe you want to just check.
I tell you, this mute's killing me today.
There you go.
But with our last upgrade, we implemented a new interface between Patient Secure and Epic that allowed us to bring to fruition an enrollment indicator so that our registrars are alerted easily about our patients' enrollment status. We have been able to add the enrollment column to both the today's patient report and to the DAR, and also to make it easier for our registrars and our point of arrival folks, we've implemented the technology within all of the areas where patients are presenting. So within the TPR, within the DAR, within L&D, ED manager, all of those areas are invoking PIDS or Patient Secure. We call it PIDS here at Sentara, Patient Identity System, because we like to acronym everything. So, but invoking Patient Secure so that we can get that positive identification for our patients. You know, we've also been able to use the technology to take advantage of the refusal reasons. So when the patient presents and they do refuse for some reason, whether it be from injury or for just personal reasons, we're able to capture that reason and then, do some reporting off of that.
Great, great. And Jose, would you like to add to the integration story at Harris Health?
Yeah, we're fully integrated since we started with Patient Secure with Epic. So ultimately, the process here is, when a patient presents, they pull their palm, like indicated, the date of birth, and Epic pulls up their record, and we're quickly identify their record within Epic so we can start the registration process. And through the emergency, the same thing. We also use the trauma search function. When a patient does present to the emergency and they aren't conscious or able to provide us that, we can then give the Patient Secure a parameter with 10 years up or down and their gender, and then it takes a little longer to identify, not that much longer, but ultimately then I'll pull up their record through Epic if they've been enrolled within the system. So we don't have kiosks that I know of here at Harris Health System. We're a big organization, but we do use them. We do have the integration between Epic and the Patient Secure system.
Great, great. And thank you for sort of walking us through that trauma search function too. So hopefully folks heard that, but that basically allows you to estimate age and gender, and the system will search. And as Jose said, it can take a little bit longer because it's got less data to work with, but it will still return a result for a patient who's been enrolled in the system. So we've heard that can be very helpful in an emergency situation or a trauma situation. So thanks for bringing that up. How about Atlantic Health in terms of your integrations there?
So we are absolutely integrated completely with Patient Secure within Epic. We started our welcome rollout last year. We do have a couple kiosks set up at some of our fast-moving pediatric departments. We haven't gotten as far as the palm scanners yet. So I know there's integration. We've been working with you guys forever to use them. So super excited. We have some new teams that are looking to implement welcome within the next quarter to two. And the expectation is to absolutely be using the palm scanners.
Sounds good. I'll just pause for a second to remind our audience that if you have any questions, you are welcome to put them in the chat or raise your hand to join this conversation. So feel free. The next topic has to do with multiple stakeholders being involved with Patient Secure or positive patient identification. So we've heard that it involves a number of departments, from patient access to HIM or health information management, rev cycle, IT, and clinical, and probably more. So how have you engaged stakeholders from these different departments and also different levels of your organization in supporting or championing Patient Secure? And for that one, we'll start with Jose.
Hi. So ultimately, we showed our success of utilizing the technology with other organizations through our system, like radiology. We've been using the system for over 10 years. We've, championed in regard to how great of a system it is because it identifies the patient without doing a guess of doing a search through Epic. So they implemented putting this Patient Secure in the radiology department as a safety net of when the patient leaves us in registrations and they're wheeled or they're taken to another department, they also do the Patient Secure as a patient identifier on their side to ensure that they got the right patient. And that's been that point of care is really important. Again, that's the safety aspect. You're going to hear that from the clinician a lot, because although you guys, it just looks like another verification point. I mean, it's making sure you're getting the right patient for the right test. And again, depending on the dosing and where you're at, it actually could be very impactful to make sure, again, in CyberKnives or something really serious, that you're going to be delivering a lot of radiation. That's really important. So again, safety is starting to peek its way through again.
And from Chrissy and Danielle, from your perspective, how have you engaged different folks in your organization at Atlantic Health, whether it's in upgrading, supporting an upgrade or expansion or training? I'm sure there's multiple folks involved. So tell us a little bit more about that.
Sure. So one of the things that I'm most impressed with is really our leadership involvement around this. I mean, our executive leadership at the very top of the organization is very vested in ensuring that this technology is utilized. They see the value in it. They look at the data on a weekly basis and, respond to that data when there's, peaks and valleys, et cetera. So that, I think, is foremost really at the foundation of our support. Clearly, our access representatives, whether it's in our hospital sites or in our practices, are really the ultimate champions, right? They interface with our patients on a day-to-day, all-day, everyday basis, and are really the ones that are responsible for the adoption. But we talk about the usage of this technology in many different forums. I mean, all of our different operational, if we're investigating an issue that has to do with patient safety or patient identification issue, we all talk about, how this is embedded in the process, how it could save us, a headache potentially if that particularly is the case. But really across all levels of the organization, there's really a lot of visibility into our usage around this and, a lot of support, across the organization.
So Danielle, okay. Danielle, I was glad to hear you talking about the senior leadership engagement because, when folks ask me what the most, what one of the biggest keys to success is, it really is having that support from the top level down at your organization and making sure that message is consistent across the organization. Here at Sentara, one of our main commitments is always keep you safe. And so, alongside of your, from an IT perspective, we're looking at things one way where, our access partners may be looking at things from a different perspective. Our clinical partners are looking at things even differently. So, it's a partnership. And, I think one of the ways that we've been able to implement that partnership here or kind of grow that partnership with the technology is the process that we had developed in the ED, where the patient presented and was being triaged and identified at the same time with our they call it the pivot process. So, we're able to take advantage of that identification of the patient and right there in the forefront. So, just some other things that we've done really to kind of support our stakeholders, having
Tara, can I jump in there for a second?
Sure.
Because you just glazed over that like it was nothing. It was like, okay, we just stick the finger in the pulse ox, we register and we're done. Can you tell me a little bit? I want some specifics because I know you turn the triage time around from 5+ minutes down to below 2?
2, yeah.
Yeah. So you're turning a workflow that normally would take, a triage nurse between 5 and 7 minutes to gather some of the technology and then send them to the registration person to get them into the system to a 2 minute. So that they were really truly pivoting not only the patient's journey, but they went into a fast track area, they went back to an emergency department, or they went back to a treatment area. It was amazing. That you just cruised right over that too quickly, because that's a huge win for you guys. I just thought that was, when I saw it, because I was down there in Virginia, it was phenomenal, and it just needs to be a little bit more attention brought to it. So I had to pause you there for a second because that was fantastic. Great job down there.
Well, thanks, Chris. Yeah, the access and clinical folks worked really well together, and that was part of a process improvement initiative within our organization to really lower that turnaround time and assist with the patient experience. But So yeah, along with our other opportunities, when we have community fairs or safety fairs, we'll bring the technology out to the community, to the hospital employees even, and, making sure that they're educated and that, they can explain, the technology and the benefits to our patients.
And Tara and others along those lines, what is the kind of messaging that you use with patients to explain or why you're using Patient Secure or why you've implemented it at your organizations? And I ask that because I've visited, I think, almost all your sites, and it seems like working with the patient access folks, there is a method, if you will, that instead of saying, oh, have you enrolled in the system or would you like to enroll today? There's often more of a, please place your palm and this is the system that we use. And I'm giving an example based on what I've heard, but I'd love it if you all would share a little bit of how you've messaged this, especially to patients. Danielle, you lit up there, so I could let Danielle take that one and then back to Tara.
In terms of messaging it to patients, it's really, assuring them that it's for their safety, not just the clinical safety in terms of ensuring their providers and their care team have the right information at hand, but also from an identity perspective, right? That, their information is the correct information that's pulled up, and, knowing that that's our consistent process, that nobody else can come in and, use their information on a separate encounter.
Yeah, and I think along those same lines is making sure that our registrars are educated in how to present that to the patient. So, you mentioned, I think some of our most successful sites are saying, let's go ahead and get you identified today, because it can guarantee you that a patient that comes into their doctor's office sick or to the ED sick doesn't remember if they were enrolled 2 or 3 years ago, right? So we want to make that easy and just take that, I guess, the work off of the patient, having to decide, is this something that I really want to do? Well, yes, because, you want to be positively identified. So I think scripting for our registrars is really, really huge.
Yeah, no, I 100% agree. If you leave it up to the patient and a yes or no question, you leave the opportunity for them to say no, right? So it's really all about how they present it to the patient in a way that makes the patient, understand this is the process, right? Yeah, you'll have patients who don't want to go along with it or maybe ask some more questions, need some more encouragement. And then, of course, a very small percentage that maybe don't want to use the technology, but all about how we preface it to that patient.
Yeah, same thing here at Harris Health. We basically, you're saying exactly what we did here. We did a big campaign with the patients that we service. Out of the patients that we have enrolled, I think I've only had 2 different situations within the last 10 years that we've used the system where they were kind of apprehensive of using the system. But outside of those 2 encounters, mostly all the patients are almost accustomed to it now, where they get to the booth and they're not even saying hi. They're ultimately putting their palm on the palm scanner, then saying hi. So it's like you indicated, it's the scripting and how we sell it to the patients that we service.
So one other topic I wanted to bring up with you all and then invite our audience to engage in this conversation as well is around COVID. So, we've heard from customers over the past few months about the various impacts of COVID on patient volume and patient identification. On the challenging side, patient volumes were initially down quite a bit, and there have also been some concerns from infection control about touching devices, which led us at Imprivata to really accelerate the launch of our touchless identification solution, which Steve may be able to share a little bit about in a minute. But we've also seen that COVID has really amplified the messaging around safety and patient safety, and your organization's websites and billboards on the highways, encouraging people that it's safe to come into our ED. We're going to take care of you, and safety is our priority. So what have been some of the impacts of COVID with respect to patients, patient identification at your organizations? And I may ask Chrissy and Danielle to lead us off on that one.
Sure, so I can get us started on that. So just to preface it a little bit, I actually joined Atlantic Health System at the end of May. And the organization I was previously with, we were actually just starting the implementation process. So I was super excited to get here and understand that we already had the technology
on the call, what's up?
Deployed. That being said, I then looked at the usage numbers and saw that we weren't really using it. Clearly for, reasons we don't need to even get into, there was definitely a stop, right, during the peak of COVID here at Atlantic Health. At the end of May, when we really started opening our doors and getting our business, back coming to the hospital and the practices for services, I took a focused look at this to understand, well, how can we get the usage back to where it used to be? In having conversations with our staff who were actually at the front lines with our patients, their perception was, well, why would I have our patients use this? We don't want to have anybody touch anything, right? They felt that it was not safe. So what I had to do as the leader from a patient access perspective is do my homework, right? Engage our infection prevention experts, right? Talk with them about the scenario. We worked out with them a little process where we used some alcohol prep pads to do an extra wipe off of the machine visibly in front of the patient, right? Because, the thought process being that if patients see it being cleaned, they'll be reassured that it is clean. We made sure that we had hand sanitizer pumps right near the palm scanners. This way they could use it before or after or both. And then we did a lot of communication and messaging with our patient access reps to ensure that they understood that it was safe, right? That this technology, is a safety technology, right? So despite what's going on in the world with COVID, our procedure in place is still safe. It's probably even more safe now with all the extra hand sanitizer and, alcohol, right? We came up with a little process where, we, wipe it down in front of the patient and, really just got back at it. And, I have to say that the results were exciting. Actually in our emergency department, the pre-COVID usage, if you can imagine, was only about 5% of our patients coming through the ED were using the palm scanners. So the bulk of our usage prior to COVID was really in our practices. After doing this intervention and getting kind of restarted, today we're seeing about 25% of our patients in our emergency department being palm scanned. So really great improvement, but again, it's really all about engaging our infection prevention specialists, having them bless the procedure, getting the confidence of our end users so that they can feel safe, right, and feel that they're doing the right and the safe thing for our patients, and then teaching them really to relay that message with confidence to our patients so that they can go ahead and use the technology.
Great, thank you very much for sharing that. And Tara, what's your experience been like over the last couple months?
So we here at Sentara, we have not been as, of course, we had, pretty good utilization before COVID. Once COVID came, leadership decided really to kind of take a pause, and we haven't been able to get that kind of momentum up again around the technology. So Danielle, what do you attribute your increase post-COVID too? Do you think it was the additional focus on the technology itself, or what do you think that was?
Yeah, I mean, after we did the re-education and the reassurance, my managers at each of our sites were looking on a daily basis of the usage, to ensure that there wasn't any one, registration team member who wasn't compliant, to make sure there wasn't any one shift, right? Like, what is the common denominator? And then focus with that particular resource in almost real time, to make sure that they were on board and that we were having a consistent process. So, we actually made sure that each team member could go in and look at their own, scan usage, right? So that they knew how they were doing kind of before we got to them, which was a good thing. So just really, I think everybody understanding that we're looking at it, helped to drive that improvement.
Right. Okay. Yeah, I think that, we're really looking forward to the touchless scanners, because we want to get back to utilizing the technology. So we're not quite there yet, I don't think.
Right. And Jose, I wondered if you wanted to share anything about what has been happening in Texas and Houston for the last couple of months, and then maybe Steve, if you're available and ready, you could give us a little commentary on the touchless identification that Tara just mentioned. So Jose first, then Steve.
Yeah, perfectly said. Texas, we live in Harris County, one of the biggest counties. Ultimately, business has not stopped per se. Everything that Danielle said is what we did here. Ultimately, the biggest one being that wiping down the machinery after every visit in front of the actual patient. And that gives them a sense, ultimately that we're taking this seriously and making sure that the machines are sterile before we see the next patient. Prior to that, we're wiping it as soon as the patient left. The next patient would show up and you could see this look of fear in their eyes. So we started doing it in front of them. And that really smoothed everything over in regards to them knowing that, ultimately we're, cleaning all the surfaces before the next patients. Like here at Harris Health System, we have not slowed down. We see patients at a high level, high volume, not as high as prior to the pandemic, but still at a high level in regards to patients that are showing up in person here for the clinics and the emergency.
Great. Steve, how about a little preview of touchless? Maybe not
Yes.
preview, announcement.
Yeah, well, first of all, I just want to thank Tara and Christy and Danielle and Jose for sharing their feedback and their real life. It's always more powerful hearing from people that are out in the field and actually using it. But this pandemic has obviously changed a lot. And it's also accelerated a lot. So we were on our roadmap, we're already thinking of changing the palm vein scanner this year. But once COVID hit, we really accelerated that. So as many of you maybe have saw, we did a press release and an announcement about a week or so ago all around our next generation palm vein scanner. So those of you that maybe have seen our old scanner, looks very different than today's scanner that I have up on the screen. And there's two things that we've really changed. So we've updated the actual sensor that does the palm vein scanning itself. And it's the latest version from Fujitsu. And when you see it in a demonstration, you're going to be amazed of how fast it is. Not that the old scanner wasn't fast, but it's amazing how faster the new scanner is. And the technology reporting is that it's even more accurate. But the best part about it is it allows for a touchless identification. So as you can see in that picture, and we have videos of this on our website that demonstrate that the hand is above the scanner when it's being authenticated and it's read. And you'll notice I have that very high-tech graphic there that says beep. That is a auditory beep that we've added as well when the scan happens. So again, for the registrar experience, as well as for the patient experience, hearing that beep, just acknowledges that, hey, we have it, we're all set, we can move on, with delivering care. And then obviously we've redesigned the hand guide as well. It looks very different than the, the old coffee cup, as sometimes the old one was referred to. It has a antimicrobial EPA rated copper coating on the top. And we've done that because copper is pretty much the most antibacterial surface known to man. So even as that device is just sitting there, during the day and not being used, it's fighting off bacteria. And then we've opened up the design, made it easier to clean, which again is feedback from our customers. So we're very excited to show this and have this used, in our customer base, going forward.
Thanks, Steve. Thanks for sharing that. So we are coming to the close here. Chris, did you have a question or a comment you were going to throw in here?
I wanted to ask Steve for a question, because this palm scan, it's being adopted more than just by us in the healthcare field now. There's a lot more about Amazon and a few other people you want to just touch base. It's becoming more of the norm, I would think.
Yeah, palm vein or vein scanning as a biometric is still, seen as, to many people, as, you don't use it every day yet, right? We're comfortable with fingerprints, we open up our phone and things like that. So palm vein scanning and vein scanning in general is still kind of a newer biometric, at least in the US. Other parts of the world, this is how you access your ATM. This is how you access buildings. It's very common in other parts of the world. And, we're sticking with palm vein scanning because of, the ability that it's accurate, it's easily used, it's fast. And as, we've heard from Tara and Danielle, the ability to identify a patient in an emergency situation is really second to none. But it is picking up speed. About a couple weeks ago, Amazon announced that they're starting to roll out palm vein scanning into their stores. So, once someone like Amazon kind of picks up on a technology, I think we're going to see vein scanning, enter our lives in the U.S. a lot more than just visiting your physician's practice.
Right.
Thanks. I have to say that the one thing that you brought up there, both that Tara and Danielle mentioned, was that you identified someone in a stroke and someone else in another situation where they weren't able to speak. This is so important now. I mean, especially when these people coming in short of breath, aren't be able to speak. They may be intubated very shortly. A lot of people only think of this as the unresponsive patient, but people, you had mentioned it, if they're incoherent, Alzheimer's, there's a lot of reasons why they would not be able to verbally, that stroke was another good reason why they, as well as intoxicated. Any one of these things that you can't speak a normal sentence, tell them who you are, like Steve is on Friday night. But I mean, that's another whole story we won't get into now. But those situations and challenges are real when they come in, and if that does it for one patient and we can access the chart, it's completely worth it from a clinician standpoint. I know that there's a lot of dollars and cents that go behind that, but that could be a life that you save with just that simple enrollment of that palm. So I think it's really it's a big win for your organizations, and I know you all three of you guys have implemented there for those very reasons. So glad to see it.
Yeah, and Chris, I'm glad you shared some of those examples. I feel like with Patient Secure, we often go back and forth between the stats and the stories. On the stat or the statistic level, there are things like medical errors are the third leading cause of death in the US. And 7 to 10% of times that people show up for an appointment, they're misidentified. So those stats do tell a story, but I think what we've found meaningful is thinking about that patient that comes in, and if it is your mother, your uncle, your brother, a relative, that you want them to be positively identified. So I was just going to ask each of the panelists to maybe share either a story, if you have one, or a closing comment as we finish out this panel. So this was a surprise question, so I don't have an order, but would anyone like to start with a story or a comment?
I guess I will. So it's Chrissy. I am super excited about the hands-free palm scanners. I know Danielle and I have been working with you guys as a team. So overall, these have been a great product to use. They work really well with Epic. You guys are so supportive, and I thank you for giving us the opportunity to speak today.
Can I follow up with that, Chrissy? Because you and Danielle both mentioned that you use the palm scanners in the clinics a lot more, and that's where a lot of the robust enrollments took place. And when we look at that, and you see the scans being done there, how much of those are really helping the inpatient now? I know you said that was the bulk of them. So now that you see them now coming inpatient, is that what you contribute some of that bump from 5% to 25%? Is that? Do you think that could be a part of it? Is that you're using it in the clinic setting?
Well, I mean, I think that's a part of the patients, kind of being aware of what the process is, right? I mean, many patients go to their physician office much more than they visit our EDs, right? Luckily. So I think just it helps to increase their awareness, but then really, actually scanning the patient when they enter the ED is really all about, the workflow and ensuring that our access team is really on point with their scripting, the process, and getting that patient to be compliant.
Great, thank you, and thank you both for joining today.
Yeah, thanks for having us.
Tara, do you have a comment or a story that you'd like to close with? One more time, unmute.
It's the hardest part of the presentation.
There you go.
No, thank you for having me today. I'm glad I got to hear Danielle's discussion, and also Jose, your discussion about the radiology and getting patients checked in or identified on the clinical side. So that was I think very, very helpful and useful. I might be picking your brain some more about that.
Great. And Jose, you were the first to introduce, and you are welcome to make a sort of the closing comment here. And you're on mute. Hold on, you're still on mute. There you go.
I said something brilliant. I didn't get to hear it. Closing out, that's the first time I got to say, I got to see the wireless palm scanner. So I guess as soon as we get off this call, I'm going to start emailing our IT department, Brad, on getting some of those for us. Outside of that, anybody who's not on the patient secure system, like I said, we've been on for 10 years. Initially, it was a slow start, but we're now at a point where the patients show up, and like I said, the first thing they do is put their palm on the actual palm scanner, and then we start our process. So it's symbiotic in regards to our process flow of getting them started, and then finishing out the registration, and then getting to the next section with the clinicians and making sure that they got the right patient and they're treating the right patient. And that's it for me.
Great. Thank you so much. Well, thanks to all of you and our audience for being part of this conversation and discussion. It's really been very rewarding to work with all of you, and I'm so glad you brought up that it was good to hear from other folks. That's really another purpose of today, is to enable different Epic customers, Epic clients to connect with each other. So thank you for helping us fulfill that objective for the day as well. So with that, I will turn it back over to Christina, I believe. Thank you, everyone.
Good. Thank you, Rebecca. Thank you, Tara from Sentara, and Danielle and Chrissy and Jose. Really appreciated